The PI3K are a family of lipid kinases that, upon activation, are important in oncogenesis. There are many different activators of this pathway. We can think of the B-cell receptor pathway, but there's also activation through other cytokine and chemokine receptors on the cell surface. One of the most important pathways that is activated is the AKT-mTOR pathway. And that makes the PI3K an attractive target for inhibition in therapies for patients with B-cell malignancies. Now, there are multiple different isoforms of the PI3K, the alpha, beta, delta, and gamma. Their expression is tissue specific. So, for instance, the delta isoform expression is limited to cells of hematopoietic origin, and it's an attractive target for if we're trying to target B-cell malignancies because by specifically targeting that isoform, we may get inhibition and a therapeutic intent without some of the off-target toxicities that might occur with inhibiting other isoforms, such as the alpha isoform, where you might have problems with glucose metabolism. There are 3 PI3 kinase inhibitors currently available for the treatment of B-cell malignancies. The first is idelalisib. Idelalisib is a pure PI3K delta inhibitor. This was attractive in the original development of idelalisib because by inhibiting this specific isoform of the PI3K, we hope to get efficacy without some of the off-target toxicities that you might get from pan-inhibition of all the different isoforms of PI3K. Now, idelalisib is approved for the treatment as a single agent for patients with follicular lymphoma with 2 prior therapies. It's also approved in combination with rituximab for patients with chronic lymphocytic leukemia. The next inhibitor that's been approved is duvelisib. Duvelisib is both an inhibitor of the delta isoform as well as the gamma isoform. Now here the hypothesis is that in addition to inhibiting the delta isoform, which is expressed in the malignant B cells, we're also inhibiting the gamma isoform, which is important in the microenvironment. And the thought here is that through these cell-cell interactions, by inhibiting the gamma isoform, we may also improve the efficacy of this inhibitor over a pure delta inhibitor. Duvelisib has been approved for the treatment of chronic lymphocytic leukemia as a single agent for patients who have had 2 prior therapies, and also for patients with follicular lymphoma and small lymphocytic lymphoma who've had 2 prior therapies. Finally, copanlisib is the 3rd PI3 kinase inhibitor that's been approved for patients with B-cell malignancies. It's approved for patients who have had 2 prior therapies with follicular lymphoma. Copanlisib is different than the other PI3 kinase inhibitors in that first, it's an IV formulation, not an oral formulation, and its schedule is different, as well as it inhibits both the delta and the alpha isoform. The alpha isoform, while inhibiting that does bring up problems with glucose metabolism, it might be attractive in that we know in some malignancies that there is data that shows that there's means of escape that some malignancies upregulate the alpha isoform, and so it might be important to inhibit this along with the delta isoform, and that's the general hypothesis behind that, behind copanlisib.